I'm Thomas Smallwood, and I'm going to be talking about thrombosis. First of all, let's define the illness. Thrombosis is the pathological manifestation of those functions of blood responsible for the arrest of bleeding. It's the process of a blood clot, also known as thrombus, forming in a blood vessel. This clot can block or obstruct blood flow in the affected area as well as cause serious complications if it moves to important areas of the body like the brain or the lungs. It is normal for the body to produce clotting factors like platelets and fibrin when a blood vessel is injured to prevent an excessive loss of blood from the body. If this effect, however, is overproductive, it can obstruct the flow of blood and form an embolus that moves around bloodstream. There are three main causes of thrombosis: hypercoagulability, injury to the endothelial cells of the blood vessel's wall, and abnormal flow of the blood. Hypercoagulability, also known as thrombophilia, refers to higher levels of coagulation factors in the blood that increase susceptibility to thrombosis. This is usually as a result of genetics or disorders of the immune system. Injury to the epithelial cells on the wall of blood vessels after trauma, surgery, or an infection can also precipitate coagulation and possible thrombosis. Abnormal blood flow, such as venous stasis following heart failure or long periods of sedentary behavior, can also cause thrombosis to occur. When it comes to the symptoms of the illness, deep vein thrombosis causes redness, swelling, heat, and pain in the area where they develop. The diagnosis is usually done by X-ray, blood tests, ultrasounds, or by measuring the blood flow through the legs. For the prognosis, the duration of therapy with blood thinners depends on various factors such as size and location of the clot, presence of risk factors associated with the clot formation, or presence of risk factors that can lead to recurrence of clots. If the risk of recurrence is low, then short-term treatment for 3 months is often sufficient. However, if the risk for developing another clot is high, long-term treatment of more than 3 months may be necessary and often lasts for several years or even the patient's lifetime. Also, 10 to 30% of people will die within 1 month of the diagnosis. However, sudden death is the first symptom with about 25% of people who have pulmonary embolism, which is a blood clot in the lungs. Physical aspects of the illness are very documented and researched. However, mental aspects are not as documented. That is very notable compared to other major life-threatening illnesses like strokes, heart attacks, that have been proven to have psychological consequences and sometimes cause other health problems. Thrombosis often limits daily functioning and mobility, which can induce anxiety or depression. In addition to that, taking blood thinners is also known to induce additional anxiety or depression due to either the daily hassle of having to take them or the fear of bleeding risks. When asked to reflect the emotional impact of the illness, patients came up with comments like, "I have a fear of dying suddenly," or "I think of my husband witnessing my collapse in our home, an image that still haunts him even now," or even, "I didn't realize the mental burden of the clot would have. 5 years later, and any time I have a symptom, my mind automatically thinks there's a possibility it could be a clot." These show how victims of the illness, or even people who are now cured, live in fear of the illness. This is due to the fact that a complication could show up at any time and we can't see it coming, so the mental preparation is at a minimum when a problem occurs. Another problem is the fact that patients diagnosed with thrombosis are often advised not to work. In this case, they would need to apply for the disability benefits from Social Security. However, to apply for that, they must show that they are not working or not doing any substantial gainful activity, but they must, above all, show that their deep vein thrombosis is expected to last at least 12 months or result in their death. If they cannot prove this, their claim will be denied. This puts the victim of the illness in a difficult situation as to if they should work and risk their life or stop working and try to apply for disability benefits if their case of thrombosis is severe enough. Now let's talk about treatments. The first treatment is an anticoagulant therapy, also known as blood thinners. In general, anticoagulants are used therapeutically to arrest an established thrombotic process or to prevent a thrombus from developing. Although they do not break up existing clots, they do prevent clots from getting bigger and others from forming. However, this method also increases the risk of major bleeding. The second treatment available is clot busters. For more serious types of thrombosis, when the blood thinners are not working, other medication can be prescribed. One group of medication is known as thrombolytics. These drugs, called tissue plasminogen activators, are given through IV line to break up blood clots. These drugs can cause serious bleeding and are generally used only in life-threatening situations. For these reasons, thrombolytic medications are only given in an intensive care ward of a hospital. The third treatment available is simply to wear compression stockings. These are a lighter treatment due to the lack of side effects, and they help prevent swelling associated with deep vein thrombosis. These stockings are worn on your legs from your feet to about the level of your knees. This pressure helps reduce the chances that blood will pool and clot. When wearing these compression stockings, you should wear them during the day for at least 2 to 3 years if possible. In conclusion, deep vein thrombosis can be a very scary illness for the patient and his family because they never know when another clot can form and potentially kill the victim. However, when treated properly, the chances of recovery are very high. This is why the patients need to be very aware of the symptoms and be able to communicate them to healthcare professionals in time so that they can be taken care of.